Stress compounds. So does retention risk. Nurse turnover rarely begins with a resignation. It begins earlier, after difficult shifts, critical events, repeated pressure, and the stress nurses carry from one shift into the next. When that stress is not interrupted, it does not simply disappear, it accumulates. And over time, it shows up as burnout, disengagement, absence, turnover risk, and staffing instability. For hospital executives, this is not just a workforce issue. It affects every priority leaders are already accountable for: retention, staffing stability, premium labor, manager capacity, patient safety, care consistency, and the ability to sustain high acuity units. The problem is that most systems are still reactive. Hospitals often respond after burnout is visible, after performance starts to slip, or after a vacancy appears. By then, cost and instability are already growing. That is why leadership has to move upstream. Joule Retention Systems gives hospitals a structured way to interrupt stress earlier, in the post-shift window when stress is still active and before it hardens into burnout or turnover risk. This is the clinical retention layer, same-day, private, one-to-one support for nurses in high-acuity units. Early support is not a wellness add-on. It is practical retention infrastructure. It helps protect staffing stability, reduce avoidable turnover, preserve manager capacity, lower downstream workforce cost, and support safer, more consistent care. If hospitals want to address burnout and nurse retention, they cannot keep waiting until stress becomes vacancy. Stress compounds. Joule interrupts it. And that is the upstream investment hospitals need now.